Dr. Vaught, please call 129. Dr. Vaught, 129.
Hi, my name is Ezra Steinberg. I'm one of the surgeons at Maine Veterinary Medical Center. This hospital has been in existence since 2008. It's about 20,000 square feet, and since then we've grown to have the most advanced and state-of-the-art equipment. And we're really excited to show it off to you. So this is our CAT scan. It's a 16-slice helical machine that's great for doing 3D reconstruction and multiplanar slices of different images. It's really good for detecting the smallest amount of an abnormality, whether that's a tiny fracture or spread of cancer somewhere in the body, all the way down to 0.6 millimeters.
Behind me is our 1.5 Tesla magnet for our MRI. We do neuroimaging here, looking for brain and spinal tumors, any ruptured discs, any spinal abnormalities, and occasional orthopedic images as well.
What we do is help your dog get better after surgery, neuro, they've got arthritis, any problems physically, muscles, we take care of it. This is our rehab room. We've got an underwater treadmill here. This is what professional athletes use when they're on their way back for recovery. This is a great machine in terms of allowing us to get dogs to weight bear and also to build strength. We also have laser, ultrasound, TENS units, neuromuscular electrostimulation units, and pulsed electromagnetic therapy. All of these non-pharmaceutical methods designed to make your dog get back to function.
We have 2 Snyder oxygen cages which allow us to house up to 4 animals, and we can titrate the amount of oxygen going from the concentration of room air up to about 100%. This is used for diseases of the lungs and of the heart where animals can't get enough oxygen to their tissues. So a C-arm, which is fluoroscopy, is used to do real-time X-ray in the operating room. This allows us to watch the imaging as we're doing a procedure, such as fixing fractures, as well as putting in tracheal or urethral stents.
We do also have a separate cat ward where it is soundproof, where they don't have to have quite as much of that stress and they can focus on their recovery and relax.
A recent part of veterinary medicine that we're focusing on is a fear-free initiative to make the hospital experience less stressful for the animal. In the new state-of-the-art ICU, we have a separate isolation ward which has 2 rooms, one for respiratory disease and one for GI disease. There's a negative pressure set up in there, so no contagious air would be allowed to enter the rest of the hospital.
At MVMC, we're so very fortunate to have state-of-the-art equipment, including this amazing double surgical suite where we can do neurosurgeries together at the same time. We also have arthroscopy equipment, and our ophthalmologist does all her surgeries here.
We perform cataract surgery, some glaucoma procedures, eyelid mask removals, as well as treat diseases like dry eye, corneal disease.
Electrochemotherapy is a way to get chemotherapy into a tumor or into a tumor bed, so after surgery, when you normally wouldn't be able to. We sedate the pet. We then give a form of IV chemotherapy that works in tandem with electrochemotherapy. And then I apply an electrical current to the tumor or to the tumor bed. And voila, we've hopefully stabilized or will shrink the tumor, or we have killed any cells that are left behind following a biopsy in order to prevent recurrence.
We are able to provide long-term mechanical ventilation to provide support for your pets at home many days if needed.
Most of my patients come to see me because they have liver disease or kidney disease or something wrong with their intestinal tract. And we have a variety of tools to try to figure out what's wrong. So one of those tools is an ultrasound. Another tool that we use is endoscopy, and that is a camera that we can use to look inside the stomach or the colon or sometimes even the bladder.
We're really proud to show off our hospital and show you that we can offer the compassion and expertise in our medical care that you would wish to have for yourself and your loved ones.